Thanks for staying with us. Tomorrow is World Heart Day. Joining us via Zoom to commemorate this day and speaking on children and adults with congenital heart diseases is pediatric cardiologist Dr. Wale Olabi. Welcome to the show, Dr. Wale.
Thank you. Good morning.
Good morning. So I want to ask this question because a lot of us are becoming aware of some of these things now. But how do you know that you're beginning to have a heart disease, first of all? What are some of the symptoms that you may see?
In particularly our case, we are pediatric cardiologists, so we deal with heart diseases that children are born with. So a lot of congenital heart disease, the symptoms occur early on in childhood, after birth. About 1% of children that are born with some sort of heart defect. So congenital heart disease is the most common childhood defect that is seen. So that takes about 80,000 to 90,000 kids are born worldwide with congenital heart disease every year. So some of the symptoms that babies can have or children can have is difficulty feeding, not growing well, failure to thrive, breathing fast all the time, and especially struggling when feeding. So those are the most common things that infants can have with congenital heart disease.
Okay, so I think it's easier if a child is born and at birth those issues are noticed. But there are some children who, they give birth to them and then they get into like primary school stage and all of a sudden, they have some problems. And what is sad is most of the time it's almost late at the time you realize that it may be much more serious. What should parents look out for a young, active child? And, what are the signs that a parent should look out for and think this may be more serious than it looks?
Yeah, so definitely in that older child, that 10-year-old, 15-year-old that's had congenital heart disease all their life, depending on the type, but you can have symptoms like difficulty breathing, fatigue, unable to complete previous tasks. So if a kid could run 5 kilometers before and now they're only running 1 or half, or they walk into school and now they need someone to pick them up or take them, getting fatigued is a big thing you have to watch for. Difficulty breathing, turning blue around the lips is also a big thing. Some of the kids who do survive into that age have some particular things that have kept them alive. So sometimes they squat down for patients that have tetralogy or Fallot, and they have an obstruction blocking the blood flow to their lungs. They squat down to help increase the flow to their lungs. So if you see a child squatting down a lot to help them breathe, that's another sign that they might have some form of congenital heart disease. The very severe types need treatment, and those kids unfortunately pass away in the first year of life. And so early diagnosis is key, but like you're saying, if they do make it on to those adolescent years and teenage years, then you're looking for things like early fatigue and difficulty breathing, blueness, and things like that.
Is it possible for a child with heart disease as a young child for it not to be detected, and then in their 20s, they now develop, like there was this footballer, Nigerian footballer, Kanu Nwankwo, that had an operation for his heart. He was at the peak of his career when the heart disease knocked him down. Could he have been carrying that as a child into adulthood?
Yes. If I remember correctly, Kanu had a bicuspid aortic valve, and that is part of congenital heart disease, and that kind of congenital heart disease can be carried into adulthood, into 40s and 50s before you have issues. It's a problem with one of the major valves of the heart, but the main issues with that don't develop until later on. You can have it develop early in life, you can have it develop in the teenage years, and then in the 40s or 50s. We, with the organization we partner with, which is Hospitals for Humanities, we've come into Nigeria, work with our Nigerian partners and organizations in Nigeria to help diagnose and treat and perform surgeries in Nigeria on these children early on. And sometimes we do see young adults now in their 20s that things were not diagnosed and it's become too late. It's too late to do anything because there's been damage to the lungs and the person probably need a heart-lung transplant, and the resources for that are not there. So as with the organization Hospital for Humanities, we are trying to partner with people that can come with us and help to diagnose, treat, and continue to treat, maintain the treatment, because this is a lifelong treatment. Over in the US, this is a lifelong treatment. Even after the initial surgery, you continue to need treatment and maintenance and making sure that's not just going to India one time and doing surgery and coming back. It's a continued treatment thing, making sure that the person doesn't relapse, they don't have further things that need further surgeries and things like that.
Dr. Wale, that brings me to my next question, because I wanted to understand how chronic the heart disease is. But now that you're saying it's a lifelong treatment, can it really be managed? And what sort of resources do you need? For instance, someone who does not have a proper healthcare system in place.
Those are very tough issues because it's a chronic disease process. 1% of children have congenital heart disease. So most of those children will do fine. They won't have critical congenital heart disease. About a quarter of those that have critical congenital heart disease. Those ones that have critical congenital heart disease, it costs a lot. You need surgeries. Most of them can be corrected with one surgery. Sometimes they need multiple surgery or surgery done in stages, so that you do a stage so the kid can get to 6 months old. You do another stage, the kid can get to 2 years old. Another stage, the kid can get to 10 years old. So it's a continued thing. And so we've worked with partners in Nigeria that have helped us to sponsor. We've done about almost like 90 surgeries. There are about 2,000 children that we know of that are waiting for surgeries in Nigeria. And unfortunately, some of those children do pass away while on the list because we just can't get to we don't have the resources to get to that. So we're definitely looking for partners to partner with us. I can give out information on that, but we're definitely looking for partners because it's a much needed thing. There are about 200 surgeries that occur in Nigeria with the aid of international partners. So if you're doing 200 surgeries a year and you have 2,000 people on the waiting list, you have a lot of people waiting that need surgery.
Wow. Okay, so I'm listening to you and thinking, so it's taking you and your and the sponsors and doctors from America to come to Nigeria to carry out these surgeries. How do you feel? What would you advise our government? In what ways would you like to see them support, to help reach the number of children who are born, with congenital heart disease? Are we doing enough? Do you think that we have not the health system now, like a Ministry of Health? Do you think they are aware of how much that is needed and what needs to be put in place to just help the children in Nigeria, that we do not have to wait for doctors from America and sponsors from outside the country, to handle what it is that we're facing?
Yeah, I think there's all over the world, there's always more that can be done, and definitely in Nigeria, there's a lot that can be done. Initial diagnosis is key. Checking things like pulse oximeter screening at birth, early, follow-ups, programs to help early follow-up with children with their pediatricians or their family doctors, things like that. Fostering to train more pediatric cardiologists in the country. So that we can have more pediatric cardiologists. We have pediatric cardiologists in Nigeria that we partner with, both from Abuja to Josh University Teaching Hospital. So all over the country, we've partnered with people there. And part of our organization's goal is to educate, train, so that it can be more sustainable in Nigeria. Over time, trying to build that sustainable thing in Nigeria where we can have continuous surgeries even when doctors from America or Europe are not coming. Those programs can be built. So the Ministry of Health can help with that. Other sponsors can help with that. Philanthropists can help with that. In the US, there are government-run hospitals, yes, but you also have private institutions that can do these things. Definitely a health system with health insurance that can pay for these things is great, because it helps people who don't have the means to pay for thousands of dollars in surgery.
Doctor, since I started talking to you, my heart has started paining me. I hope it's all right.
You're not a child.
I'm sure you're fine.
I hope so. I've been feeling tightness. Yeah. I don't like discussing health issues.
This kind of issues, right? So, Dr. Wale, is there anything parents can do? For instance, pregnant women can avoid in the course of pregnancy so that their children don't come down with heart disease. Is it preventable?
Generally not. There are definitely some things like don't drink while you're pregnant. That helps to prevent fetal alcohol syndrome and things like that. Avoid hard drugs, avoid smoking. Those can cause some insufficiency to the placenta. Those kind of things are key. But the thing about congenital heart disease is that it just tends to happen. So it's that early screening. Once the baby is born, making sure the baby is checked out really well. If someone says your baby has something, don't disappear for 3 years or 5 years, and then you show up in urgency at that point in time. Make sure you push to your pediatrician. Make sure you push to your family doctor that, okay, someone said this kid had a murmur or they heard something or the kid's not growing well. You'll be the advocate for your child. And then, for our community sponsors across the country, if people want to partner with us, they can call us with HFH, Hospital for Humanities. Our website is hospitalforhumanities.org. Our phone number is 864-571-0604. We are looking for partners because, like I said, we're trying to build that sustainable culture in Nigeria so that these programs can be sustainable. Like, we don't want to just do it where we come, do 2 surgeries or 5 surgeries and we go away, and then it's not sustainable in Nigeria. We want it to be sustainable. We want so that this can continue. So we need partners to partner with us, because these surgeries are not cheap. In the U.S., those surgeries can cost $100,000.
Wow.
For one surgery to keep that person in the hospital for that period of time.
It's a lot of money.
We've yeah, it is. So we've been able to do it. We donate our time when we come. We don't take any money from anybody. So the money and resources that we get is to get the amenities that are needed, because those things it's pretty expensive to keep a heart-lung machine and things like that.
In this part of the world, we like to pray that God will help us and not give us a disease that our money cannot even go halfway.
That 60 million that you just said, the person will even have heart disease, God save. Thinking about this, the whole family will get the heart disease, honestly, not only the child.
Wow.
60 million.
Thank you so much, Dr. Wale Olabi. Thank you for being on the show this morning and enlightening us. That's all we can take on today's show. Join us tomorrow for another exciting episode. Bye for now.